Getting you some answers here about the coronavirus. We have a local expert joining us.
That's right. We're joined on the phone by Dr. Erika Hamiton, microbiologist from UMass Amherst. Dr. Hamiton, as always, thank you for taking the time to join us this afternoon. So we'll start here. Why are officials saying we've entered a new phase of the pandemic?
So the statement was made by Dr. Deborah Birx, who's the White House physician who oversees the current coronavirus response. And she was referring to a couple of changes that have happened in the U.S. since the coronavirus pandemic has started. We've had an increased death rate across the country. We have increases in COVID cases, and they keep increasing and increasing, particularly in places like the Midwest, the South, and the western regions of the United States. And there's an increase in the number of younger Americans who are contracting COVID-19, and they are bringing it home to older relatives. You take all of these problems and you combine them with the financial problems that are a lot of people having, the issues with the federal government not being able to come up with a stimulus plan, which makes people really uncomfortable and nervous. And then this big question of what do we do with schools when fall arrives? And is it good to open them or not open them? And so without interventions, and what she was trying to say is that without interventions in some of these harder hit areas, our death toll is going to continue to rise. And that is problematic.
Yeah, no doubt about that. All the more reason to stay on top of it. And something always staying on top of is clusters, hot cluster spots popping up. What can states do to help minimize the spread of the virus there?
So one of the things that will help states to decide what to do is to try and figure out what happened. So, for example, if there are some clusters that have arisen in a particular state or a particular region, contact tracing can tell state public health officials if there was a particular event associated with this cluster of people getting sick. Was there a wedding? Were a lot of people at a particular park? Were there a lot of people at a particular beach? Once you can figure these things out, it can tell the state whether or not they should do things like close a beach or a park, whether they should limit the number of people going to places like that, and how much they should require the use of masks, social distancing, having hand washing stations or hand sanitizer available, and to show where increased testing is necessary.
All right, and last question for today. Is there any new evidence that hydroxychloroquine might help fight COVID-19?
No, there is not. In fact, the clinical trials into whether or not hydroxychloroquine can stop or help people who have COVID-19 had to be stopped over a month and a half ago. And these are both U.S. clinical trials and clinical trials in other parts of the world. They were shut down because not only was the hydroxychloroquine not working, but it was causing some pretty significant side effects, including heart arrhythmias, liver problems, and kidney damage. So when the treatment is worse than the disease, it's not necessarily something you want to use. Now, I know that there is a video that is running rampant throughout the internet and on social media saying that hydroxychloroquine, along with some other medications, works to stop COVID-19. This is not factual information, and it is not true. So even though it sounds like a great thing, it is not correct.
Thank you for always bringing us the facts every single time. Dr. Erika Hamiton, we appreciate you coming on. And, of course, we're going to have more of your insight here in the coming days. Be well, all right? And everybody at home, you continue to be well. Tune in each weekday right here at 12:30 on ABC 40 as we have Dr. Erika Hamiton and other pros answer your questions about the global pandemic.
Now, still